In the late 19th century, when medical science was still finding its footing, doctors often relied on courage, observation, and bold experimentation rather than advanced technology. One such fearless pioneer was Dr. Louis A. Sayre, a man who would later be remembered as one of America's first true orthopedic surgeons. At a time when spinal deformities like scoliosis were considered lifelong curses, Sayre believed something radical, that gravity itself could become a healing force. In the 1870s, his clinic became the stage for a treatment that shocked both patients and fellow physicians. Sayre suspended scoliosis patients from the ceiling by their arms, allowing their full body weight to pull downward. As the body hung freely, the curved spine slowly stretched, sometimes straightening before the eyes of stunned onlookers. Sayre carefully studied every movement, every shift in alignment, convinced that nature, when guided correctly, could correct what seemed broken. But he didn't stop there. While the patient was still hanging in the air, often trembling with pain and fear, Sayre wrapped their torso in wet plaster of Paris. As it dried and hardened, it formed a rigid cast, locking the spine into its newly corrected position. The process was painful, exhausting, and terrifying, yet undeniably effective. For many patients, this method brought something they had never known: relief. They stood taller, walked more comfortably, and escaped the heavy iron braces that once crushed their bodies and spirits. Though controversial, Sayre's method laid the groundwork for modern spinal traction and orthopedic casting. His patients hung by their arms, but more importantly, they hung by hope, suspended between suffering and a future where healing was finally possible.